The plan would be overseen by a national health board and 12 regional boards modeled on the Federal Reserve. That is, the officials would be appointed for long staggered terms, could not be removed, they're not political appointees, so that they are insulated from political pressure. They have the finances through the the dedicated value added tax, so there's not annual fiscal pressures on them by Congress. They set the standard benefits package. They oversee these insurance exchanges. They get information from the health plans on their performance, and they report to the American people in Congress about the performance of the healthcare system regularly. 9, there's an Institute for Technology and Outcomes Assessment. One of the problems of our current system is we don't actually monitor the value of new interventions. We don't monitor how patients are doing overall. We conduct these sort of random big studies about how people are doing, but we don't regularly get data. And as most businessmen recognize, without data, you can't manage. You need to know the performance to know whether things are getting better or worse. This institute is all about collecting data. We propose to fund it with about 0.5% of the value added tax, and to collect data, evaluate new interventions, see if they're actually worth it, evaluate how patients are doing in the various health plans and insurance plans. Finally, to solve the medical malpractice problem, we propose each regional health board have a center for patient safety and dispute resolution. So patients who feel like they've been harmed by medical malpractice would report to these centers. They would investigate and adjudicate, and they would also have authority and responsibility for instituting patient safety measures so fewer people get harmed by the medical care system. Well, I want to conclude with 2 points. First, how does this Guaranteed Healthcare Access Plan deal, or how does it fulfill the 4 big issues? Coverage, cost, quality, and helping the economy. Well, first on the access issue, it guarantees all Americans, all 100% of Americans, health care insurance, regardless of income, regardless of age, regardless of health care status, regardless of any other characteristic you can think of. There is no premium, so you don't buy in. There is no deductible, so there's no financial barrier to get health care services. Even if you don't sign up, you're enrolled. So everyone is in the system. No one is barred from the system. This is the one plan that gets true 100% access. What about controlling costs? Well, first of all, through the insurance exchanges, we reduce insurance underwriting, sales, and marketing costs, which amount to about 10% of premium now. There's no cost by evaluating whether a poor person is eligible, so we get rid of a lot of excess costs in Medicaid. There's no business costs associating with managing insurance. But more importantly, looking into the future, by having a dedicated value-added tax, we force ourselves to live within our means. If we want to increase the package, we want more benefits added to the standard package, we have to be willing to pay the taxes. Given how much American population loves to pay taxes, I think it'll inspire some fiscal discipline in this area. Second, given competition between health insurance plans about trying to get people, I think they will be able to be more cost-effective and more efficient and keep costs under control. Third, given that Americans will be able to buy supplementary insurance, but if they have to buy it with money from their own pocket, they're going to be pretty scrupulous about whether they're getting value for dollar. They will try to keep costs down. Most importantly, going into the future, I think that Institute for Technology and Outcomes Assessment is going to provide us very valuable information about what medical procedures work, so we're not spending so much money on wasteful services that really don't improve health. But also, it sends a message backwards, a message to the drug companies, to the device manufacturers, and other people developing medical technologies. You've got to develop technologies that really add bang for the buck, that don't add 6 weeks of life for $55,000, but add real cures to people. We're willing to pay for that, but we're not willing to pay for marginal things. That will change dramatically the incentive structure for drug companies, device manufacturers, and others in terms of what they actually generate. Quality, given a fixed budget to provide for people, but also this risk adjustment, insurance companies are going to have a very strong incentive to develop the infrastructure, the information systems, to get high-quality care to people. If they're monitored for patient outcomes, they're going to have to develop information systems, and they're going to have to improve outcomes. Furthermore, because individual Americans hold that certificate and decide which plan they go with, there's going to be a very strong incentive on those plans to actually satisfy individual Americans' needs and demands that they provide high-quality care. Finally, helping the American economy. Taking health care out of employers, I think, is going to be a huge boon. For individuals, it does two things. It guarantees them portability. If they lose their job, if they change jobs, if they want to start their own company, they still have health insurance. Second, it gives them security that long into the future, they will have health coverage. Even if their son or daughter develops cancer or someone gets sick, they are not going to go bankrupt just because someone needed health care coverage. Furthermore, almost every strike in America over the last 10 years, except the Hollywood writers' strike, has been about health care. No one has any idea what the Hollywood writers' strike was about, but it wasn't health care. We get rid of that. It's no longer a labor management issue, health care. So it has a lot of advantages for the American economy. Let me conclude in the last few minutes here talking about political feasibility. As I mentioned at the start, to get anything enacted requires four things. It requires an agreement that there's a problem, agreement on a solution, a strong champion for that plan and agreement, and finally, a transforming political event that opens a policy window in which something can be enacted. As I mentioned at the start, I think we're getting national consensus that there's a problem, that we don't have the best healthcare system in the world, that it's got serious, serious flaws, and it's only going to get worse and not better. Look at the transforming political event. That is something that is, by definition, unpredictable. And you know what? People who have studied this point out very interestingly that the absolute worst people predicting when that policy window opens and when major policy change can happen are not you and I, but politicians. I heard you whisper that. That's right. Politicians are the absolute worst predictors as to when a policy window will open. So we don't know when that's going to happen. So what's our responsibility in this room? I began hinting at it, and I'm going to close by making it very explicit. We need to get the country in agreement on a solution that we all can live with, that marries the right and the left, that marries those people who want the market and those people who want government oversight to make sure the system's working. That can be bipartisan. Because, to be honest, we are not going to have major change in this country unless we get the wide middle to agree. Now, I think, for a variety of reasons, our plan has got the best chance of getting the wide middle. And let me end with this. There are two enduring values in American society. Equality of opportunity. We want everyone to have an equal chance in the race. Our plan gives everyone an equal standard benefits package, which everyone is entitled to. If you want more, you can buy more, but the good, robust plan that everyone's entitled to. So we satisfy equality of opportunity. Second, we're a country of individualists, and we believe in individual liberty. And our plan also incorporates that message. We have a private delivery system in the market. We allow people to choose which health plan they want, and more importantly, we allow people to buy up and spend their money if they want on health care. And if they don't want, they can spend it on other things. Good meals, vacations, education for their kid, a lovely car, lovely house, whatever they want to spend it on. We think our plan marries the virtues of the market with the virtues of government and coheres with the fundamental American values of equality of opportunity and liberty better than any other plan. And I hope that over the next 5 or 6 years, we can get widespread agreement on that and implementation. Thank you very, very much for your attention. I look forward to your questions.